Hello everyone, let's discuss CURB-65 criteria. The CURB-65 criteria is used in pneumonia for two purposes: to assess the severity of pneumonia and admission criteria in pneumonia. So for these two purposes, we use a CURB-65 criteria. How we measure the CURB-65 criteria? The CURB-65 criteria consists of 5 parameters. As the name indicates, CURB-65, and each parameter have 1 point. In this criteria, the C stand for confusion, U stand for plasma urea level greater than 7 millimole per liter or 19 mg per dl. The R stand for respiratory rate greater than 30 per minute. The B stand for blood pressure. The systolic blood pressure less than 90 mm of Hg and the diastolic pressure less than 60 mm of Hg. And the 65 represent the age. So all of these parameters consist of 1 point. Therefore, if a patient present to emergency with pneumonia, so how we will assess the severity of pneumonia and the admission criteria? We use this CURB-65 criteria. If we calculate all of these 5 parameters and if the score is 0 to 1, in this case we should treat the patient as an outpatient by giving oral amoxicillin alone. Other than this, if we calculate the score and the score is 2, if the score is 2, admit the patient in hospital and start amoxicillin plus clarithromycin. If the score is 3 plus, it often requires the ICU care, and in ICU we give a proper antibiotic such as IV co-amoxiclave plus clarithromycin, or we have another regimen such as cefuroxime plus clarithromycin or the cefotaxime plus clarithromycin. It was all about the CURB-65 criteria, that how we will assess the patient with pneumonia and what should be our treatment approach. Now let's take a two example. So with the help of these two examples we will clarify and simplify the CURB-65 criteria. In first example, let us consider a patient who presented to emergency with shortness of breath, fever and dyspnea. On examination, the patient is not confused. Urea is less than 7 millimole per liter. The respiratory rate is 16. The blood pressure is 110 by 70 and the age is 70 year of age old. If we might take this examination and we measure the CURB-65 criteria, the CURB-65 score is 1 because all of the parameters are normal except the age. So in this patient, we discharge the patient with oral amoxicillin alone. We will treat this patient as an outpatient. Now take another example. For example, if a patient presented to emergency with shortness of breath, dyspnea and fever. On examination, you find that the patient is slightly confused. The plasma urea is normal, less than 7 millimole per liter. The respiratory rate is 35 per minute. Systolic or diastolic blood pressure is 110 by 70 and the age is 55. If you calculate the CURB criteria with this help of this examination, you find out that the CURB-65 score is 2. So in this patient, we will admit the patient in ward and we will treat the patient with amoxicillin and clarithromycin. And if the patient is penicillin allergic, we can use doxycycline instead of amoxicillin. Now come toward the last example. For example, if a patient presented to emergency with the chief complaint of breathlessness, shortness of breath, fever with chill, and if you examine the patient, you calculate the CURB criteria. In this CURB criteria, you find out that patient is slightly confused. The blood urea is greater than 7 millimole per liter. The respiratory rate is greater than 30 per minute, and the blood pressure is about 90 by 60, and the age is more than 65. In this scenario, the CURB-65 criteria is greater than 3. So according to this scenario, if the CURB-65 criteria is greater than 3, the patient need ICU care. So we will shift the patient to ICU and start an IV antibiotic such as IV co-amoxiclave plus clarithromycin or cefuroxime plus clarithromycin or cefotaxime plus clarithromycin. So it was all about the CURB-65 criteria along with example. If there is still any question, you guys can ask and stay tuned for more update.